My name's Dr Rebecca Szabo, and I'm an obstetrician and gynaecologist and also a medical educator. I'm the lead of education and simulation at the Royal Women's Hospital, and within that role I organise something called Grand Rounds, which is traditional to big teaching hospitals like the Royal Women's Hospital. And within that space it's provided for everyone in the hospital, whether that's clinical staff or people from language services, or really anyone who wants to get involved and come along. And so the themes and the topics are often those that are related to healthcare but might sit within a broader space.
And today's topic was?
So today's topic was health professionals and human rights advocacy for asylum seekers and refugees. And this was the final grand round of the year. We've had 6 months of, in some ways, a curated theme of ethics within medicine. That was not necessarily deliberate in the beginning, but it's evolved that way. We've been very fortunate to have Professor Dominic Wilkinson from Oxford University come and speak about ethics of newborn resuscitation. We've also had Dr Ruth Mitchell from ICANN come and speak about the Nobel Peace Prize.
It's the international campaign against nuclear weapons.
Yes,
yeah.
And that's because that initiated from a group of doctors and medical students in Melbourne. And they were the Nobel Peace Prize laureates of 2017. And we've also had a few other ethical grand rounds. And Professor Louise Newman AM, who is a psychiatrist and activist and advocate in the space of refugees and asylum seekers, and is our director of the Women's Mental Health Centre, was due to give a grand round in November, which we actually planned 6 months ago, completely remote of any events that are happening now in Australia. So about 4 weeks ago, Dr Sarah Townend and Dr Nila Janakiramanan organised a letter that ended up being signed by over 7,000 doctors and health professionals, and that letter really galvanised a lot of people, and there was a new surge of interest that I think most of us haven't seen in this space since the Children Overboard situation.
And their letter urged that children and their families be brought.
Yes, so they linked
in
with the Kids Off Nauru campaign and have said that this is a medical emergency and that we need to get the kids in particular, because it's the initial focus, off Nauru and to Australia and to the mainland. And so, in part because of that, and Louise was already going to be talking, we decided that wouldn't it be great if we could actually have a panel and give the health professionals here at the hospital and others within the precinct, the Parkville Medical Precinct. So we've opened our rounds to Royal Children's Hospital, the Royal Melbourne Hospital, Peter MacCallum Cancer Centre, which is also co-located, and also those within the university precinct. And what could they practically, legally and ethically do in this space? So we're very fortunate that the panel therefore had a human rights lawyer that works in this space, who's Professor George Newhouse, and also an ethicist, Deborah Zion from Victoria University, to provide a different perspective, and also a multi-professional group of health professionals, so including one of our midwives, Cara Blackburn, who has worked extensively with MSF in the past 10 years.
And you said when you opened the discussion that you bring some personal experience and heart about this issue. Can you talk about that?
I can try without crying,
yeah.
But I might cry again. So I'm first generation Australian. My family is Jewish background, and so I am the child and grandchild of refugees. And so for me, I think Deborah explained it the best later during the panel discussion, when she said she grew up in a household where trauma and knowing people who had survived the Holocaust and atrocities was normal, and she didn't know that other families grew up without that, and I would say that's the same. The Melbourne Jewish community is almost exclusively made up of those who have descended from Holocaust survivors, and I don't know that there is anyone I grew up with within the Jewish community that didn't have a personal connection. and the intergenerational trauma with that is quite significant. And so for me, it has never been a question of not to get involved in this space. Both myself and my sister, who happens to be a human rights lawyer, have been involved in human rights in some capacity, definitely for our adult lives, if not longer. I think as a human being and as the child and grandchild of refugees, it hits me greatly. And I struggle with being someone who is a very proud Australian and very fortunate to have been born in this country, because my father was born in Budapest just after the war, and so I told you I won't cry again. And when he was 18 months old, my grandfather, who had survived Auschwitz, saw what was about to happen again in Hungary and decided it was time to leave, because he knew that things would really happen, because prior to World War II they were like, no, that's not going to happen, we're Hungarians. I fought for the losing side in the First World War, that's not going to happen to us, and now he knew it could. And so they made the very difficult decision to leave, and they left the only way they could, which was illegally with people smugglers. And my uncle remembers my father as a baby being thrown over a fence, a barbed wire fence. And they were very fortunate to get safely to displaced persons camp just outside Vienna, and then eventually get a visa to Australia. But my father almost died several times because he contracted scarlet fever, and then by getting a visa to Australia and being able to thrive in this country, my sister and I have now both gone to university. My parents both went to university, and have greatly contributed to this country. And as a health professional, I have looked after vulnerable populations of refugees and asylum seekers here in Australia. I've also lived in Thailand, in northern Thailand, in Chiang Mai, where there is a significant population of migrants and refugees, predominantly from Myanmar. I teach a maternity safety workshop called the Advanced Life Support in Obstetrics, and I've taught that in Mela refugee camp, which is on the Thai-Myanmar border, to refugees who are not healthcare workers, but deliver their own babies and look after themselves because of the situation there. So it's very personal significance to me.
And it was there were some equally personal experiences in the room, both among the presenters and in the audience, people whose parents were refugees, grandparents were refugees, yep. And also some people who were refugees and are now working in the health yep. system here, and really urged action from health professionals. It was a really, really incredible feeling in that room. What did you take away from it?
I think it's really hard sometimes to have hope. I think that it's really challenging when we've been working in this space for a really long time to have hope. And I think for me, there was one of hope in that room, actually. I think there were a lot of people in that room who are aware of the issues, but I equally think there were a lot of people who came along because they were interested. And I think, as you said, I think there was a lot of heart and a lot of humanity. I think hearing from Angelica, who is one of our interpreters with our excellent language services, and hearing her story. She's originally from South America, from Colombia, and hearing her describe being a child as a 10 or 11-year-old and going through her situation and the vulnerability of that, and then being able to come to a country and restart life, but also the vicarious trauma of being an interpreter and interpreting for people who might have traumatic situations. And that's equally a reminder to all of us as health professionals that we do suffer vicarious trauma. We listen to stories and we care for people, and it's very hard to care for an individual in front of you and not want to do more. And really challenging sometimes to know what to safely do in that space, because our duty of care is to maintain confidentiality and look after that individual. But I think that's, as I said, one of the reasons why and Michelle touched on, the community trust us. They trust us more than almost anyone, any other community, any other professionals within the society. And really, I think we are very privileged to be able to do what we do, and very privileged that we are respected and listened to, and that really behoves us to have a voice.
So you felt a lot of hope in the room. What do you hope to come out of the room?
Well, I think, the aim of all the Grand Round discussions has really partly been to provide discussion, and in some capacity assist the culture and the people here to have exposure to things. I didn't set this Grand Round up necessarily hoping for anything more, but the sense from the room, and as Professor Steve Robson, who's the immediate past president of Ranscock, said, was really that, well, why don't we stop just talking about this and do something, and is there a way that the AMA and the colleges can collectively come together and actually show leadership on this and issue something collectively? So I think that's certainly something to follow up on, and that was the tone of the room, that it's time that we all come together, which to the general community might sound unusual that doesn't happen, but actually medicine and nursing and midwifery and the allied health, we're pretty siloed, and it's very unusual for us to become very galvanised on a particular issue and want to collectively do something together. And that's in part because, just like the rest of society, there are a lot of diverse views and political views and people within medicine and healthcare.
As we've seen on Twitter, there's a lot of people making the connection between this meeting today and the fact that Dr Karen Phelps is it will be introducing a bill to bring children and their families from Nauru to Australia on medical grounds. Is there something that health professionals can do to assist that?
I think so. It's a hard one to wade into in terms of federal politics. And I think that that's a really interesting space at the moment, and one that we have seen is changing rapidly, certainly in the past 2 weeks. I think having a united voice from health professionals is certainly something that will help the wider community and our politicians feel safe to support this bill. And I think Karen's voice is extremely powerful, and has been powerful because she has truly shown her independence, that she isn't there for politics, that it is about compassion and about humanity. And for those of us other health professionals to, if we can have a collective voice to support that, then I think we make it safe for people who have been worried about veering away from their own politics. We make it safe to truly make this about humanity and compassion and not politics.
Fantastic, Beck. Thank you very much.
Thank you.